Well, welcome back, everybody, to our online program on addiction recovery. And we've been talking about these interesting things that show up in public about the addiction or recovery field that we're kind of curious, given that we've had 40 or 50 years of research in the field and in many ways have progressed quite far. And one of the things that I find really interesting, and this is very American, by the way, is this recent call that we're hearing now from professionals in the field. So, for example, this one came from the National Governors Association and the American Medical Association, and that was in February 2016. So just this year, and they make this statement that we must prioritize treatment for substance use disorder, which is a medical disease that needs our care and compassion. Which is really a curious statement because, of course, many commentators have pointed out that this new interest in care and compassion seems to have arisen because many of the people overdosing on opiates now are like white middle-class kids or adults. So this is interesting, right? And it was only this year that it looks like the President of the United States actually sort of hinted at that maybe the whole policy was racist. And for me, of course, we know like just about 20 years ago, Alan Marlett, one of the great gurus in the addiction field, actually pointed out in great detail about why the drug policy was racist. And he made a very good case for it based on the number of inmates and stuff that they found in the jails. And even before him, there was a historian, a guy by the name of Charles Whitebread, and he was a legal scholar, and he had pointed out this racism, decades ago. So this has all been going on, and everybody, at least in the scholarly field, has acknowledged it. But it's interesting that in the public world, it's only starting to really surface now, which is a good thing, of course. So it's one of those curious things, and you wonder about, why, if we've known about this for decades, really, why didn't we acknowledge this before? So again, it's just this curious thing that we find popping up in public now. And many commentators have mentioned that it's very likely linked directly to the fact that many of the opiate overdoses are with the middle-class white population. All right, interesting things. And we'll be back next time with another topic.